Have you subscribed to our channel yet? If not, I'm encouraging all the viewers in Zambia and across the world to subscribe to our channel. When you go through our channel, you will learn and realize one thing, that Zambia has powerful people. But one thing continues to bug me. Why are we still poor? Could it be low self-esteem? Well, I feel that it's time for us Zambians to unite and actually begin to support each other for real. In Africa, thousands of women face life-threatening pregnancy complications every single year. But this could be prevented if only mothers had access to the right information and timely medical guidance. Now, this is where Dawa Health comes in. We are in Mandevu, Lusaka, Zambia. And I'm going to be introducing you to one of the brilliant, extraordinary minds behind this digital health platform made for expecting mothers and mothers.
Hi, my name is Tafazo Munzo. I'm a medical doctor by training, technology innovator by passion, and we are changing Africa using artificial intelligence. Welcome.
Receiving $50,000 in Dawa month.
Some of you may be doubting his services and how authentic his app is. Well, he has won so many awards, both local and international, and that already tells you just how authentic everything is. Now, this young man saw the problem and solved the problem. Looking for professional photography services? At the Stones, we specialize in capturing excellence. From executive launches to timeless weddings, we aim to deliver with a modern touch. To us, every detail matters. Your brand, your memories, your legacy. So whether you're celebrating a milestone or building one, we make it unforgettable. Book or contact us today. The Stones, exceptional service you can try. Zambia is known for so many things, but digital maternal health? That's not something you hear every day. How did this idea come about?
Okay, thank you for having me, Princess.
Yeah.
So this concept started back around 2021. The original concept was my cousin. So I'm a medical doctor by training.
Okay.
Then in 2021, she was pregnant. It was her first time pregnancy. Then she had a bit of complications. She was swelling her feet and all that. So I thought, was there more we could do for maternal care for people like my cousins at the time? Then when we did more research, we saw that it was even a bigger problem. It was just not my cousin or people I knew. This is a significant big problem. So about 800,000 mothers every day in the world, and 2/3 of that are in sub-Saharan Africa, which is acceptable.
Yeah.
That we are losing our cousins, our sisters, our mothers from maternal health issues, which are not even considered complications medically. Pregnancies, it's not a disease.
Yeah.
So it's a normal physiological process, but women still die from it. So I thought there was more that could be done about this case. So the original concept I had, I thought we needed to make self-monitoring kits for patients to take home, so that they monitor to see if they're high-risk pregnancy. With that, we applied into the ZICTA ICT program, which is an annual program they run every year to support local innovations in Zambia, then accelerate them, then the winning top 5 get a bit of capital to kickstart their ideas. So we went through ZICTA, then we came out second, so that gave us a bit of capital to really build on the concept. So that's how we started, mid-2021. We got
So
support
like
from
you won that award
Yeah.
without even them seeing it actually.
Yeah, I just did a prototype. Then I had like a small chatbot that patients could ask questions. Then it would respond back.
Yeah.
Then that's what won us the whole Zeta program.
Nice.
Then from there we got that capital. We started using it to test and build more. Then from there things have just gone, higher and higher. From there we got selected into MIT program. That was 2022. Then we went to the US, we got more support, really big funding from that enabled us to now get these mobile clinics, operate in more vans. So with time now, as we've been doing this for some time, about 3-4 years, we've learnt more complications that come around pregnancy. And we've just been developing more software, more interventions around maternal care ever since. And we've quite grown significantly from there when we started at Sector to where we are now.
Okay.
Yeah.
How does it make you feel when you look at the different mothers that are using your services? How does that make you feel?
It's unexplainable. It's a priceless feeling, honestly, because you actually see the difference you're making last mile. To say, this goes way beyond even a clinical medicine. As a doctor in a hospital, yes, you can make a difference to a high-risk mother who comes in, but this we're doing it at the community level, so our impact is way bigger. And now we have a bigger team that has grown just from this small concept. Yeah. We have over 80 community healthcare workers who go into the communities to sensitize mothers about their service, about the program across all the facilities we run. Then our clinical team, I think, is now close to 15 who operate across all the clinics we operate. So that's a kind of impact, you wish for. We never thought we could grow to that extent when we started. We thought this might be run at a single clinic. We make a difference, but we've been doing this over about 5-6 clinics now across Lusaka. We've just started in Harare over 2 clinics in Zimbabwe. So this is something we're really excited to say, can this grow further beyond Zambia to more African countries? Can this be adopted by the government to be scaled across all the government clinics? Eventually, that's the dream, where you're getting support from, the higher authorities. So that's now the bigger dream. I really believe this can significantly cut down maternal death we continuously have across sub-Saharan Africa.
Now look at this. Now this is something I am looking forward to seeing across the country. Tell me about those awards.
So it's humbling, honestly, to get recognition for the work. Zicta was unbelievable. I could not believe we won Zicta. It was my wildest dream to say, are we going to even, this is just an idea I have. Went to the Zicta, they saw the vision, they supported us. I thought that was big. After that, we got into MIT. I'm like, MIT, these are places you read about.
Yeah.
So we had to go to MIT. They gave us support. They gave us significant awards. Got from Johnson & Johnson, Patrick McGavin Foundation, MIT themselves. That enabled us, came with cash prizes. Then when we came back, enabled us to implement. With implementation, we've managed to get more awards from there locally, internationally, regionally. So it's humbling to just see that people actually can see, the impact of the work we're doing. But I feel like, it's more than the awards why we do this kind of work. We want is just to make a difference, to save lives. That's what we're now trying to really monitor across all the clinics we run. How many women are we making a difference? How many tests are we doing? This facility is our biggest facility, Mandevu. So in a month, we can get up to 600 patients who come here. So it's our biggest. And we're actually making a difference because also locally, there's a group of people who don't believe in this new healthcare. They call them as a Zuru decide. So they don't seek healthcare. So with our community healthcare worker, we've managed to start convincing them to come for antenatal. So those are the kind of patients or demographics who will be at risk to die from maternal complications because they never come up for the clinic. They believe they do home delivery. They believe in just doing everything at home. But now with our program, we're able to get into the community, sensitize the people. They're coming here. Somewhere like we didn't even know that we can get such services. So it's that kind of, so you see with this kind of work, it goes behind the clinical side. You get to the public health side, get to the how people think around healthcare. What are the barriers that prevent people coming here? So we're trying to essentially, demystify some of the things they have, the myths and all that. So it's really fulfilling. Reflecting back, I'm glad we started this journey. Of course, we were worried, we were scared, we didn't even know how we were going to do this. But yeah, we're here today, and it's humbling to just know that God, of course, is allowed, and everyone, all the supporters who came through, have seen the vision and they supported us to be where we are now.
So you're a medical doctor, right?
Yeah.
And also a tech wizard.
A bit. I've always been passionate about tech since I was young.
Yeah.
So I was Bongo Hive. This is where the whole original idea started. So Bongo Hive is like a local innovation hub. They're based in mass media somewhere there. So I always used to go to Bongo Hive. They have tech programs they run. So before we got to ZIT, actually, we went through Bongo Hive. Then the founders believed. Then I was a student. I was a medical student, and I didn't even have capital to afford the program. But they believed in what I was trying to pitch. They're like, this is something exciting. Come, we'll waiver the fees for you. Come join the program. I was in my third, fourth year then.
Yeah.
Then I joined Bongo Hive. Then they supported me. So that support has always been instrumental. So with that, I had found my co-founder, who's a software developer. He's a computer science graduate. He's the one who helps develop most of our apps. But our team has grown beyond. We now have about 4 people who are developing our tech.
Nice.
So the team has grown, but I had a bit of good understanding of what the tech we needed because of my background and my passion with tech. Then I combined that with my clinical experience to just see what could we do. Then over the years, it has grown to where we are now. Yeah.
All right, let's now dive into Dawa Health. Yeah.
Okay.
Tell me about it.
So Dawa Health, so this is a Swahili name. Dawa means medicine in Swahili.
Oh.
So at the beginning, I thought I wanted to build something more Pan-African, and I thought Swahili was a bigger Pan-African language. So that's why we decided to go with Dawa Health. So we now essentially position ourselves as a femtech platform. So femtech is essentially building products around female and maternal health services. So we provide sexual reproductive health care, from contraceptives to cervical cancer scan. We have a new app we're excited about, which we just made in the last month, that enable us to identify high-risk cervical cancer patients. So when you take a picture of the cervix, it's able to tell you if there's cancer or if there's no cancer and what stage it is. And this is a tool that can be used in rural areas where they don't have complicated labs, where we need to take a tissue, send it to the lab and do that. You can just use a smartphone app. So this is something we're really pushing. It just got accepted into the MIT program. So next month we'll be out of the country for that as well. So yeah, Dawa Health is just a femtech platform building female reproductive healthcare services. Maternal health was our first point, of course, because of my cousin. Then we've been operating maternal health over some time now. We've supported over 15,000 patients to date. Our team, like I explained, we now have over 15 midwives, clinical officers who runs in the clinic. Then we have over 80 community healthcare workers who go into the communities to tell people about the program, about the services. So the team has really grown from a small team of 2 people at Bongo Hive to now we're almost over 90 who are operating.
Oh,
Yeah. So that's exciting, and it's humbling at the same time that God continues allowing us this to happen. And they have gotten support from Grand Challenges Canada, who are helping us now take this to a bit bigger level. We're hoping now we integrate this into the government. So we've been talking to the SMS at Chipata Level 1, who is like the medical superintendent, to have a permanent partnership where we can actually integrate across these low-income communities and be making a difference at that level. So yeah, that's how Dawa Health has evolved.
So I'm with Armstrong, one of the sonographers here at Dawa Health. Yes. How is your experience working with Dawa Health?
Okay, so my experience with Dawa Health has been very interesting. I'm clocking a year now with Dawa Health.
Nice.
So yes. So when we started, of course, it was something that raised a lot of questions. Looking at the environment that we are in, it's Mandevu. A lot of people are so adhering to the cultural values and many other things that hinder them to seek for modern health services.
Yeah.
But with our work that we've done, at least we've seen ourselves transforming the community. A lot of women here, there are those that don't believe in antenatal, but we've seen them coming closer to us and knowing the importance of antenatal in us. So throughout, it has been an amazing journey, and knowing for sure that I'm part of those who are making a change in our society. It has been a very, very amazing journey, and I don't regret. It has shaped both me and the organization I work for, together with the community that I'm targeting as a sonographer here.
All right.
Yes.
That's nice. Yeah. How are you finding it?
Okay, just been a good journey being part of Dawa Health. has really helped me in a lot of different aspects of my life. It has really shaped me, and it has really helped the people out there, expecting mothers, in different aspect of their lives. It has helped them, educating them about the advantages and the disadvantages of of starting antenatal care early and of not starting antenatal care early. And it's also helping the less privileged expecting mothers in at least there are those chances where they are given those birth kits. Yes. So I think Dawa is really helping every expecting mother out there.
Started from like two co-founders with a passion, a medical student, and then my co-founder was a computer science student at UNZA. Then people just believed in what we were trying to do. Then after that, we completed our trainings. We're now trying to really do this at scale and potentially scale it across, many African countries, more than just Zambia where we started. So it's something we're really excited about.
Okay. Now I want you to explain to, let's say, to that mother out there exactly what you guys do.
Okay, great.
In the language they understand.
Yeah, in a language they understand. So maternal health is important for pregnant women. For example, I'll say, because we are able to see if there are any risk factors or risk that might be high for them, if there are any complications that might happen to the mother. So that's why even if you go to your local hospital or clinic, they'll tell you you need to be coming for antenatal, because in the antenatal period, medical people are able to look at the pregnancy. Is the baby okay? Is the mother okay? This is essentially using what you call clinical judgment, or what we go to school to train for. I'm able to look at a mother and say, her BP is high. Then I touch the womb. Then I see, is the baby seeming like it's okay? But it's just based off what I can interpret. So what we have come to do as Dawa Health, or as what we're adding a layer to help such people really see if there are complications that might happen. Like we will see when we go inside, there's what we call an AI-powered scan. So this scan is essentially helping a midwife or a clinical officer at your local clinic to be able to really look at the baby. So there's what we call, for the baby to come out when you're giving birth, the head of the baby has to be facing downwards so that when you push, the baby passes out nicely. But if it's not like that, those are what we call high-risk pregnancies. So those kind of mothers, usually we need to cut them so that we get the baby out, because the baby won't pass normally. If you try to push the baby will die or the mother will die. So that's some of the things we do with our scan, which uses AI, which is new technology. People say AI, which they don't need to be afraid of, because it can actually do more work outside of what humans can do. So like that scan you see later on, it enables us to see where the womb is, how the baby is looking, if there's enough fluid around the baby, if placenta, what do we call placenta in a local language? Yeah, I forgot what we call it in the local language, but it's essentially what enables the mother to give food to the baby. So when the mother is eating, because the baby is in the womb, cannot eat, the food now passes through that organ, what we call the placenta, to go to the baby. The air you breathe goes to the baby through. So our technology enables us to see all that. Is the placenta at the right position? Is it high risk? Is it all that? Then we are able to advise a mother. No, you cannot give birth per local clinic, no. Go to UTH, go to Levy, go to Chipata. So with this kind of technology, you'll be able to make such things. They're able to see high-risk patients so that you don't waste time, so that nurses don't rush when you're trying to give birth to say, this pregnancy is not progressing. Let's try to look for an ambulance. Let's try. Those are the moments mothers might die, children might die, because people are now rushing to try to transfer the mother. Without technology, we see that before it comes. Before you even start giving birth, they're able to see that this pregnancy is too complicated for a local clinic. It needs to go to my bigger hospital, Nana UTH, Nana Levy, Nana Chipata. So that's what we really do. We are helping my midwives and my clinical officers, my local clinic, see if they can handle pregnancies or not. That's what we started. With the new one I was talking about, we're bringing cervical cancer. So Zambia is number 2 in the world, if you didn't know. We are number 2 for women who die from cervical cancer. in number one, it's Eswatini, number 2, it's Zambia. So it tells you that something is wrong with our healthcare system. Not enough women are being screened for cervical cancer, or our diagnosis tools at the local clinics are not good enough to pick high-risk mothers. So we created an app that will enable you to take a picture. When the midwife goes in to check the cervical cancer, instead of just using their eyes, they take a picture with the technology. That picture is fed into an AI system. Then the AI looks at the picture to say, are there tumor cancerous cells that maybe the person could not see? Then it's able to tell you this is a high-risk patient, refer them to a higher hospital where they might need to get treatment. So with such technologies, it means no one will die of cervical cancer in Zambia, because we're able to screen when you're at level 1 or level 2 cervical cancer, of which those stages are treatable. You can be treated and completely live a normal life after. But what happens in most patients, they come in late. They come in when it's my big chilonda in the uterus, and we just, doing what we call palliative care, supporting you until you die. So we believe with technology can really help health workers who are in the last mile to see high-risk patients and be able to save lives across Zambia and across Africa.
This seems to be a very interesting room. So what's going on here? Where have you brought me?
Okay. Thank you, Princess. So this is our ultrasound scan room.
Okay.
This is where, after the pregnant woman has been seen in the other rooms, she comes in. So we're essentially trying to do an ultrasound scan. So this is a low invasive scan we do to see how the pregnancy is. So it tells us a number of things. Is the baby growing okay? Are there any abnormalities? Is the baby having any deformities? Is the fluid around the baby enough? What's the position of the baby? What do we call position? Is the head facing the cervix? Then the baby can be born normally, or it's the other way around. We need to refer now to a higher institution where they have to do an operation. So that's essentially what we are looking for here. So we have the conventional ultrasound, which is the traditional. It requires a sonographer who's trained to do this. But you also have the AI, which you'll be able to see. So the AI enables even low trained person, even yourself, you could do the low AI one, because the AI essentially just looks at the imaging itself, then it gives you a small report. So it's more applicable in the more rural areas where you might not have sonographers working. So it's still within our interventional study right now to see how well it does compared to the conventional one. So yeah, that's pretty much what happens in this room.
I'm very interested in the AI one.
Okay.
Can I see how it looks like?
Yeah, sure. You can look at it.
Okay. This is like the coolest thing I've seen. So
Yeah, no, thank you. Thank you.
Can I hold it? Can I?
Yeah, sure.
So when it captures the information, does it go directly to your system, to your app?
So it goes directly into an app. So there's this app we call the Baby Checker. So that's where the AI is embedded. It's embedded in this app. So you just essentially do a scan here. So as you can see, we have a number of clinicians, or our team is registered here, because in the back end we want to be able to see who did the scan, who's performing good scans, who's not performing good scans. So you can see, I'll choose myself. Then you put your patient's ID. So this is essentially what we use to de-identify the patient. We don't write their names. We give them specific IDs. Then once we are done, we go next. Then we already have to do the scan. So the app or the AI can essentially see that the probe is connected. If the probe is not connected, it'll tell you that the probe is disconnected.
Nice.
So if it's connected, it's connected. Then you essentially press scan. So as you can see, it doesn't show you the images a traditional scan would show you.
Yeah.
It just tells you what you need to do on the belly. So it's telling you for sweep 1, start there and finish there. So as you can see on the scan, you have this side where there's a sticker and the side where there's no sticker. So the side where the sticker has to be facing the patient. So if it's like start from 1, this is starting from the lower part of the abdomen as you're going up.
Yeah.
This is facing the patient. Then if this sweep is good enough, it will now say go to sweep number 2. If it's not good enough, the AI will tell you to repeat that same sweep, because it will see that the imaging quality you took is not good. So if it's good, you do sweep number. So there are about 6 sweeps you do. So about 1, 2, 3, 4, 5, about 6. So once you do 6 sweeps, the AI then analyzes the images that were being captured from here. Then it now give you a summary report. For example, how big the baby is, where the placenta is. So the placenta is how the mother communicates with the baby. Yeah, so if it's low, those are high-risk patients. They usually bleed on giving birth. So if it picks that up, it will tell you refer this patient. That patient cannot deliver from this kind of facility because this is a lower facility. You need to be at a bigger hospital, maybe Chipata level 1 or UTH or Levy. Because if the patient starts bleeding, you need to give them blood. Here we're a smaller place. We are not able to do that. So it's able to kind of assess the risk of the patient. Is this a patient you can kind of handle here, or you need to refer them to a higher center? So that's really how the AI is really useful. It's able to pick up risks that traditionally someone would not be able to have. And we're hoping we can scale this across, the country, because the lower parts of the other centers, they don't even have the traditional scan. So most clinicians go in blindly. They just be like, okay, this seems like a safe pregnancy. Let's try to deliver. If we fail, then we try to refer. But this already tells you before you even attempt, is this something you can handle there, or you need to refer it quickly? So we have a number of AI tools we've integrated in our care process to kind of help our clinicians diagnose high-risk pregnancies in time.
This is very interesting because I have never come across this before in any clinic.
It's new. It's new technology.
For how long has it been around?
We've been doing this, I think, for the last 1.5 years.
Okay.
Yeah, but we're still doing the study itself to see how good the AI is, because there's a lot of what we call data sets in AI. So data sets is the data you use to train the AI. So for the AI to be that good, it needs to be trained using local data sets. So you cannot take a data set from the US or from China or from India, then train an AI for Zambia, because the patients are completely different demographics. So the AI would be wrong using a data set from China, for example. So we're in a process of collecting our own data set, because whenever we capture this, we also capture the conventional, so that when we compare them, then that's the data we then feed into the AI, so that it learns from the actual real data of the patient based on a traditional scan. So yeah, that's the process we've been doing for some time.
So can an ordinary person actually purchase this and have it in the homes?
No. It's not yet there.
Okay.
It's not yet there where people can purchase it in other homes. But that would be a good clinical use case.
Yeah.
Where, because this anyone can do it even from home. In the long run, that might be a good clinical use case.
Tell me something about this.
So this is being manufactured by a partner in the Netherlands.
Okay.
So they make hardware ultrasound scans. So as you can see, this is a bit different from the conventional one, because this has a C-type at the end. But the quality of this is essentially the same. So you can use this if this conventional scans at a C-type, because it has there's what we call a crystal in here that emits sound. Then the sound is reflected back in the pregnancy. That's all physics behind getting an ultrasound scan. So this probe releases sound, then the sound reflects back into the probe. Then from the reflections, it's able to tell you, is the surface it reflected hard? Is it soft? How far is the surface? That's how you get that image on your ultrasound scan. So what this probe does is essentially the same. So it pushes sound into the womb, then it gets reflections back. Then from there, we are able to capture those reflections back into the app. So in the app, that's where you get frames. If it's in videograph or pictures, you have what you call frames. So as the clinician is doing scans, you're capturing frames of images.
Yeah.
So as they move from the lower part of the abdomen to the higher part of the abdomen, you capture about 150 frames. So as it moving, it captures about 150 frames. So as you do the both or 6 squat sweeps, it's capturing different frames at different positions. So the AI then feeds over that now. So that's where we are coming in as Dawa Health, because this is externally manufactured somewhere else. We had to partner with these people to help us bring with the data, with the hardware. Where we are now going in is to the software part, where we fine tune the AI to fit our local needs, because AI essentially has to approximate the population it's going to work in. If you train your AI using American data, it might give you bias with local patients, because American patients are different to Zambian patients.
Yeah.
So what we are doing in the process I explained, like the last 1.5 years, is we are doing 2 scans per each woman who comes. We're doing the AI one and the traditional one. That goes into our data set. So we're creating our local data set, because we label the data set using the conventional scan. It tells us from the conventional scan, how big is the pregnancy, what was the baby's age, how is the fluid around the baby. Then with the AI, we tell it to say, this image you are seeing, these are the parameters. Then it feeds off that data to fine tune to the local Zambian patients. So I'm hoping, maybe by next year, this will be something that will be scalable across Zambia, because it would have essentially approximated the AI to Zambian patients, which makes it accurate for local clinical diagnosis. So
like, is the app your creation?
yes,
Your development?
so it's part of our so we have an ecosystem of apps. So this is just one of the apps.
So it's locally made.
Yeah, it's locally made. It's just one of the apps. So we have the main app. Before they come here, we have an app we capture the data from. That's where we get the patient's name, what we call demographics,
Yeah.
their age, if they're married, if they're not, the past medical history. So we capture also that information, because it's important for another AI that approximates risk of other things. So we are using a number of tools we use to capture a lot of patients. So in the care journey, we have a number of contact points we have with the software. So we have the reception, where we get the general demographics, past medical history, examinations. Then we have the scan, where we're now using imaging AI. Then we have another AI we outsourced from another company that essentially estimates hemoglobin, or what we call blood level, because in the low risk clinics in the communities, in the rural areas, they don't have these big facilities like where you can have a full blood count. A full blood count, essentially we get your blood, it's run into a machine, then it tells us where your hemoglobin is or where the level of your blood is. They don't have that in a rural setup. So we have another AI that's coming to cater for that, because a woman who has low blood is at risk of bleeding and dying at giving birth. So we hope such tools will be applicable in the more distant rural communities, where we now have things like Starlink. You don't have to have infrastructure in the most rural places you go to. Like we were over the weekend in Chongwe, rural Chongwe. There was no internet. MTN was not working there. Airtel was not working. So in such setup, these kind of tools might be useful if you bring in a Starlink and you have such tools. It helps a nurse in rural Chongwe to make a difference to a mother, to know, can this mother deliver at this local clinic, or we need to refer this to Lusaka? Then that will make a difference in that mother's life if she was going to succumb to any complications.
Right.
So yeah.
For me to access your services and your apps, do I have to pay? Is there a cost that's attached to that?
Very good question. So we have a minimum implementation fee for patients so we have both. We are a for-profit company and a non-profit, so we're a hybrid enterprise. So depending with the circumstances, we also have a CSR wing. For example, over the weekend when we went to Chongwe rural area, that was our CSR wing. So all the women we saw in Chongwe, it was free because it was our CSR. But if you come into any of our clinics, you pay minimum fee, like 100 kwacha. We are way cheaper than the private sector. If you go to a private hospital, an ultrasound scan would cost you maybe 400 kwacha to 500 kwacha. But because we're doing this for impact, we brought the price down. We don't want to overcharge, because we want as many women to be able to afford, but also to sustain the operations of the whole enterprise. So for basic services, how we normally operate, if you join our program, you pay 200 kwacha joining fee. This enables you to get all the tests. Then every month you pay 100 kwacha. For any additional services, either home-based care or you come into our clinics. So we make it really affordable compared to the private sector. It's not too different from the government, though some of the services we charge are free at government facilities, but our efficiency and other things compensate for that. So yeah.
How do you manage to convince the various women in the communities to come and use your services? Because most women tend not to go to the clinics, because obviously there's negligence. You see how some nurses get to shout at the mothers. They don't even understand why they're being shouted at, but there are all those issues surrounding these situations. But how do you convince them to use your services?
Okay, great. That's a very good question. So I think over the years, what we've really learned is firstly to upskill our staff with the kind of customer care. I think traditionally, healthcare, or us as health workers, we assume that healthcare is a need, so customer service is not important. You are coming to us anyway. So unfortunately, that's the attitude most health workers have. If you go in the public sector, unfortunately, I'm saying you're coming to me whether you like it or not. So that doesn't really develop my customer care skills. So what we have done with our team, we usually do monthly trainings around different aspects of the whole care process, to train them on how to do the sensitization, how to talk to women in a language they understand. Like I'm explaining to you why antenatal is important, why if you come here, there'll be advantages. Like I was explaining, you get a number of scans, you get 2 scans instead of 1 scan, but we explain why you're getting 2 scans. Or the test we do explain why it's important for you and the baby. So we do those trainings with our team, even in the field. So they come at all our centers. So they come here usually every Friday, last Friday of the month. We meet the whole team, from senior staff to the people in the community. We talk about the challenges they're facing, what we could do as a team to overcome those, how they need to communicate to the mothers, how the staff, when they come here, should treat them. So it's a whole kind of process we've been trying to reinvent around maternal care. And I think that has pushed our numbers, of course, because getting 600 mothers is significant for such a place. So yeah, it's. I think that's what we're trying and what we continuously try to do. Just make sure that we're at the same level, from senior staff to even the team that's in the community, in terms of our customer care, how we treat patients. Sometimes patients don't do things because they don't know. So instead of you shouting at them, explain why certain things are important, why they should not do certain things, than just shouting. So that's what the culture we've been trying to develop in Dawa Health. And I think that has significantly made a difference because we continuously get good feedback from people who use our service, how they really love the staff, how they're treated, how the service has made a difference. So I think that is also just building, kind of human referral, what we call like social capital. Pregnant women who've used our service refer other pregnant women. So I think that has really worked for us, and we'll just continue learning from that. What we need to improve, what we need to change, over time.
Yeah, I really wish these health facilities can adopt what you guys are doing, because pregnancy is very delicate.
It's
Our
very-
health is very delicate.
Yeah.
Some love and compassion would go a long way.
Yeah.
Tell me something. You are a whole trained medical doctor, so why are you not working for the government?
That's a good question. Very good question. Unfortunately, the healthcare system in Zambia over the last couple of years has been saturated. So our government doesn't have capacity to employ everyone who's trained. So you see that most people are either volunteers or they're doing something else. So out of that as well, it was a good motivator for me to continue doing this work because you can actually make livelihoods outside of waiting on government. You don't know when their next recruitment is. So yeah, this is something that's, one, sustaining myself, but a lot of other unemployed health workers who have joined this mission. So yeah.
If someone would offer you that job employment opportunity, would you take it right now?
Now it's possibly not. Because I've seen the potential for what this can do.
Yeah.
So beyond it, empowering myself, making an income for me, it makes a bigger impact, and we can scale this across many, countries just outside of Zambia. So that's something more exciting and thrilling. We have already a bigger number of partners coming into play, so that's exciting. So possibly not, but yeah, it's good to make a difference, at a public hospital. Yeah.
Right. We've been talking about AI throughout this conversation, and many people are skeptical when it comes to AI. So how safe and reliable is the information that these AI are giving us?
Great. So AI is a big term people use for a number of technologies. So there's what we call computer vision, which you see when we go in. There's what we call natural language processing. So natural language processing is what happens when you're speaking to your chat GPT or to your Meta AI. You're able to have a conversation. So that's just, those systems were trained on English, so they're very good on English. But if you want to make an AI that's, for example, clinically useful, it needs to have people who are coming in from the clinical background to train the AI. So unfortunately, most of the time, that's what not happens. You have some software developers in Silicon Valley in the US making a system. They don't even know our local challenges, our local needs. So it might not fit to our local needs, which is where we are trying to fit in. Because, for example, our natural language processing chatbot, we worked with over 20 health workers, medical doctors, medical licentiates, who translated a very big data set into local languages. So we made a maternal health database that advises women from week 1 to week 40. And we were using the UTH protocol. So if you go at any hospital, there's what we call a protocol, which health doctors there and health workers uses as a guide. What medication should I give? If a patient is like this, what should I do? So we got that protocol because I was at UTH throughout my training. We got the protocol, then we incorporated it with a number of other information from local text, medical text, to create a maternal health database, which is accurate, clinically accurate. It's based on WHO, it's based on UTH. Then we translated that into local languages. So we had people who speak Bemba, who are native Bembas, translate the data set into Bemba. So they translated the whole maternal data set into Bemba. People who speak Lozi did the same. Natives of Tonga did the same. After we had these data sets, so we have about 7 languages, then we used our AI to train it on that. So AI becomes very accurate because the advice it's giving you, it's taking it off a standard protocol, it's taking it off UTH, it's taking it off WHO, and we're also taking into consideration the translation, because a developer in Silicon Valley won't understand a certain translation into a local language because they're not a native. They don't know how people speak. So that's why we even had to hire medical people from those native languages so that they understand the language and how people really translate beyond just academic translation, you know. So that's what we did with our natural language processing. Then with the scan, you see, which uses a different types of artificial intelligence. For laymen's, we just call it artificial intelligence, but they work completely different. So the AI scan is what we call computer vision. So computer vision is essentially using images for the AI to kind of analyze. It's different from the language one. So the scan, that's what it uses. So when you do your scan, it's capturing frames of images as you do the scan. Then it uses those frames to analyze. So it's quite accurate, like you will see. When a trained sonographer does the scan, you compare that with the AI one. You see how accurate it is and approximates almost to what a trained sonographer would give you. So it's quite accurate with the local setup, because we've been doing this research for some time and we're continuously improving the AI. Where it gets errors, we go and correct it. So we are hoping maybe by the end of next year, it will be almost flawless in terms of the support it can do. And we're hoping to add more local languages as well from the 7 we have, so that it can be scaled across the whole of Zambia.
You spoke about the chatbots and how it can speak various languages.
Yeah.
Tell me more about that one.
Okay, so what we did, we created a data set around maternal and cervical health. So it guides mothers from week 1 up until delivery, the same for cervical health. Then we got native speakers of those languages. So we got Bemba, Lozi, Nyanja, Tonga to then do translations. After we did the translations, we used the technology you call natural language processing. So it's an artificial intelligence that processes language like how humans would, to understand words, to understand context, to understand all those. So that's what we did. Then we trained it on that. So you can essentially ask anything for maternal health in any
language,
any of those language, and it will correctly tell you what you need to do in your local language.
No, that's very interesting. I need to try this one.
Okay, sure.
Wait. So you said any language?
Any language.
Okay, since I'm more confident at Mbemba, let's try it in Mbemba, right?
Okay.
Okay. So how does one get access to?
Yeah, so you can go onto our website, then you see a WhatsApp button, then you can click that WhatsApp button, then it take you to the WhatsApp chatbot. So once you do that, then you now have access to WhatsApp. Then you can start the conversation, and it's called Rudo, which is a Shona word that means love.
Nice.
So we thought, we'd be giving love to mothers, so that was a suiting name.
Nice. Okay, so let me give it a try, yeah?
Yeah.
Okay. So Rudo. Since I'm going to be speaking Bemba to this Rudo guy.
Yes.
Let's assume it's a guy. The app is a guy.
Okay.
We'll call it Rudo Mwansa.
Okay.
Mwansa is Bemba, right?
It's Bemba.
Yes, Rudo Mwansa.
Chanda.
Rudo Chanda.
Yeah.
Okay. So I'll start by greeting it. And then I'm not pregnant, but I'm asking on behalf of pregnant Jane at home.
Yes.
So let me tell it I'm pregnant and I need this kind of advice.
Yes.
Oh. It's actually very fast.
Yeah, it's very fast. It replies in milliseconds.
No, just using this, I already feel loved.
Okay. That's good.
I feel rudoed.
That's good.
Okay. This is very exciting. This is like one of the firsts that I've come across that are actually exciting to use, and I'm looking forward. I'm encouraging the viewers out there, give it a try.
Yeah.
It can speak, imagine a chatbot that can speak Nyanja, Bemba, Lozi, Tonga. Have you tried with this chatbot? and give us your review in the comments.
Yeah, and for teenage mothers, we actually have a promotion. You can join our services, and we offer free service for teenage mothers. So for those 200 free women we see every month, we usually target teenage mothers who might be disadvantaged. So if you're a teenage pregnancy, join the service, please. We'll be able to support you, and you get most of these services for free.
So many youths that have so many brilliant ideas, but most of them, the excuse they'll make is, well, I'm failing to work on this idea because obviously I don't have capital. So what advice would you give to them?
That's a very good question, because I started such a youth. So firstly, you have to really be committed. Things are not going to move as fast as you think they will when you're starting. Unfortunately, that's the kind of mindset we usually have as youth. That if I start this idea, by next year, I'm someone very big. We started working on this way back in like 2020. Got accepted into Bongo Hive Zicta 2021. Today is 2025. This is when we're just starting to have impact and things are starting to make sense. Because unfortunately, partners support people who they see that they have the passion. For example, I'll give you Zicta. So Zicta is a good program to start because it's free entry, and now they've really tried to spread it across the country. So you look up the Zicta ICT program page. So they open up applications every year. Then the top 100 sometimes youths are selected across the country. Then you go through a training program for about 3 months in Zicta, where you have different experts coming to teach you about the business, teach you about partnerships. Airtel is some of the backers who back that program. You have people like Stanbic Bank. So that's some of the programs that are easily accessible to a youth who doesn't say, I don't have capital. That's how we started. You apply for such programs. There's Zicta, there's the Tony Elemelu Foundation done in Nigeria. They open applications every year. You also got a grant from there. So that's how you start. You don't give excuses. And one fear I also had when I started was someone who steal my idea. Implementing an idea is very hard. No one is going to steal your idea. So be open to share ideas to experts. They give you feedback. It might be very brutal. They'll say, you've not thought about the business. You've not thought about this. It's good for you because you start to see gaps in your idea where you need to improve. So that's the advice I'd give to the youths. Don't hold on to your idea thinking someone will steal it or think you don't have capital. Put yourself out there. People support what they know. If they consistently see you doing something, they'll eventually come through. Now we're being supported by the Canadian government, the Grand Challenges Canada, which enables us to do some of our CSR work. Even the interventional study you see, some of the pregnant women, we scan about 200 women every month for free. Because it's in our interventional study, because that cost is catered for by someone else, right? So that's where you start. Partners will come in to invest in you when they see that you have the resilience, you have the passion, and you're committed to what you say you want to do, not just mentioning to say, I have this idea, I'm not doing it, because start where you are. You're somewhere. If you can make apps, make apps. If you cannot make apps, partner with people who can, and also that's the other concept people get wrong as youths. You want the idea to be yours. Yours. Nothing is ever built by one person. It takes a team of people to build. Even if you see what we're doing with Dawa Health now, I have different people doing different things. I have people who are doing tech. I have the midwives who are running the clinics. I have business people who are making sure the business is running well. We are compliant with PACRA. We are compliant with ZRA. All those, you cannot do it as a one-man show, right? So as youth, find people who you think are good enough to help you in your idea. Partner with them. If you have to split equity, that's what most people worry about. Split. I always have a saying that a piece of a watermelon is better than a grape. So if your idea is small as a grape, would you rather have a grape or would you rather have a slice of a watermelon? Right? A watermelon is bigger. So if your idea has more people who help you build it and it becomes a big idea, a small slice of that is way better than having everything of a small idea, which is nothing. So that's the philosophy I work with. So even if you see when you start bringing in investors now, which is the stage we are going in, investors want part of your business, and to give you capital, they need to take part of the business. So you need to be willing. But also be careful with who you are getting that support from and all that. So that's the advice I'll give to youth.
Bonus question. What is one thing you'd change about Zambia?
That's a very deep question. With my background, one thing I'll change is the healthcare sector. I think we need more privatization as well, which some people might disagree with. But I feel like we empower more people with that. Why I'm saying that, if you have a couple of unemployed doctors or unemployed health workers, they could come together, set up a center, right, which could start helping them earn a livelihood, but also make a difference in the community, right? With the work we've been doing, I've learned that, if we competitively scale at that, that would employ a lot of people across the health sector. We don't have people complaining about the government is not providing jobs. Us as youths, as Zambians, we need to start thinking of ways of how we can innovate and create employment for other youths or for ourselves, right? So if that's one thing we could change, it's that mindset that everyone who's trained is hoping the government would want to employ them. Come up with initiatives. I hope in the future Dawa Health can be such a partner. That's the vision I'm starting to have now. Partner with local health workers who want to open clinics. We maybe empower them with some of our technology. Then they're able to efficiently run those clinics, provide better healthcare to lower income communities and community generally. And eventually maybe Zambia will be, a destination of choice for medical tourism. We've seen education taking off in Zambia. You see that a lot of students are coming from all over the region to get their tertiary education in Zambia. Maybe that could happen for the healthcare sector as well. The mindset that we have to wait for government to provide us jobs and all this we have as graduates, that's why people go to university. Think outside of the box. What could we do as locals to create employment and make a difference? So it's that. In my sector, it's still a big challenge. Everyone is complaining. Government is not providing healthcare jobs. But we could, start thinking outside of the box and make a difference. Zambia could be destination of medical tourism. That's one thing I just think about sometimes. I'm like, that could work, and it would become an economic wing for the country, because if people coming from other countries paying the US dollar to get healthcare service here, and the healthcare system, if it's working synergically together, that could be achievable.